For calorie counters,
Give me 1 second.
it's pounds.
Because it is a significant amount.
Kristen Smith is concerned about dollars at the city of Fort Worth.
Luckily or unluckily, I've been talking about this a lot.
The city's HR director says weight loss drugs are tipping the scales for the city's budget. GLP-1s like Ozempic now make up more than a third of employee pharmacy costs.
Every other drug for every other category, meaning, cancers and MS and, just everything that you can think of that would be covered on a health plan. That one category alone is 40%, and it is actually over 40%.
And expanding fast. Fort Worth says the number of people on the drugs went up by nearly half between April and May alone.
I describe it as a little bit of a runaway train in being able to rein in those expenses.
Otherwise, city departments like parks and libraries and others will start to feel the squeeze and be forced to trim. And it's not just Fort Worth. Dallas says employee healthcare costs are nearly $14 million over budget, supersized in part by GLP-1s.
The most immediate way to reduce the spend in this category is to change the coverage.
Fort Worth is notifying employees it plans to cut coverage for cutting fat, at least pharmaceutically.
There are many other ways to approach weight loss.
Smith says the city considered whether employees with healthier weights would mean fewer expenses in the long term for things like heart issues or knee replacements. But with the cost for these drugs at more than $1 million a month, it was just too heavy to bear. Back to you.